Jones urged pedestrians to exercise caution when crossing Mandela Highway amid death of 11-year-old. Dr. Lucian Jones, Vice Chairman of the National Road Safety Council, is appealing to pedestrians to use the designated area when crossing the busy Mandela Highway to reduce the risk of injury or even death. His call follows the death of 11-year-old student who was mowed down by a motor vehicle on the highway. He has been identified as Darren Mackenzie. According to reports, the child got off a bus and was heading home from school when he was hit by a minivan. The driver did not stop at the scene but was later apprehended by the police in another area. All pedestrians on the Mandela Highway have to be extremely careful and use only the overhead bridge to cross the road. To try and cross that road 10 yards away is courting disaster and death and injury, stated Jones. Jones noted that of the 171 people who have been killed in the road accident this year, 38 were pedestrians. It's an alarming bit of data because the vulnerable road users are the ones who are dying mostly on the roads. The death of a child on the Mandela Highway brings into very sharp focus the importance of protecting our pedestrians from mayhem and chaos on the roadway, he noted. He described the Mandela Highway as a very dangerous place with a speed limit of 80 kilometers per hour. However, he said motorists generally exceed this limit. He stated that once motorists are driving over 30 kilometers per hour, the likelihood of a pedestrian surviving a collision drops dramatically. Jones reiterated calls for motorists to reduce their speed, especially when driving in built-up areas. The World Health Organization has mandated all countries to ensure that, especially in built-up areas, the speed limit does not exceed 30 kilometers per hour, so the slowdown or control of speeding is the number one factor, he noted. He also emphasized the importance of providing adequate pedestrian facilities while urging pedestrians to take responsibility for their safety. The pedestrian crossing, the sidewalks, the markings, the supervision of children around schools, encouraging children to look right, look left, and look right again, he said. He added, of course, we have to make sure that just as in the case of driving, pedestrians are not driving alcohol and trying to the roads, not using marijuana and trying to cross the road, not getting distracted with use of cell phones and trying to cross the roads. The processing of physical evidence may have varying turnaround times depending on several factors. JCF's Forensic Services Branch. Head of the Constabulary's Forensic Services Branch, Senior Superintendent Christopher Brown, has explained that the processing of physical evidence may have varying turnaround times depending on several factors. He made the comment following concern about the time it takes for the police investigations to be completed. The Forensic Services Branch is a new unit established by the Jamaica Constabulary Force, comprising entities that exist before. Speaking during the JCF's Force for Good podcast on Sunday, SSP Brown said what people see on the television show is not always the reality in cases. He said while members of the public may doubt the unit's involvement in investigations, it plays an integral role in the process. SSP Brown has reaffirmed that the JCF's commitment to keeping stakeholders and the public informed about investigative procedures.
All right, so policing is both an investigation, is both an art and a science. The forensic science is that kind of behind the scenes work, often associated with that fancy thing on television, CSI, that lends a kind of support to investigations. It's difficult at times to share with the public that what you're seeing on the television is not necessarily the reality of the case. There are turnaround times regarding the processing of some physical evidence. And so it's not necessarily going to happen within 24 hours. It's not necessarily going to be happening in 48 hours. Sometimes some of these tests or scientific responses to our investigation does take some time. And we want the public to appreciate that we are working on these things and there's a time associated with it. So one of the biggest challenges is really competing with the Hollywood effect of CSI and providing that accurate, thorough, and reliable support from forensic services. That important science plays a role in all investigations, as it relates to the work of the CFCD. Missing person investigation is one of the things that they actually support investigators with. We're able to provide timely and accurate and reliable information to investigators regarding efforts to go searching for missing persons. But rest assured that the CFCD provides reasonable and sufficient support to investigators regarding missing persons investigation. So I would say to those persons who are wondering whether and to what extent we are offering that support, it's a commitment, a credible commitment that we do go searching for persons in the digital landscape as well as in the traditional landscape to support investigation.
Health Minister Lebasque opposition for spreading misinformation about Cornwall Regional Hospital rehabilitation cost. Health Minister Dr. Christopher Tufton has again lambasted the opposition People's National Party for allegedly spreading misinformation about the cost of rehabilitation works being undertaken at the Cornwall Regional Hospital in St. James. Dr. Tufton claimed that the conditions at the hospital resulted from years of neglect by previous PNP administrations. The minister chastised the opposition for seeking to frame the narrative about the renovative work on the so-called cost overruns and delays. He said the PNP conveniently executed the context to include how much money is being spent on the project. He cited figures quoted by the PNP with multiple variations, pointing out that these are in fact project costs. Dr. Tufton noted that contrary to what the PNP claims, the government has so far spent over $9 billion on the Cornwall renovation project. He chastised the opposition for what he described as being dishonest.
Let me just outline. The government has so far spent more than $9.4 billion on Cornwall Regional Project, not the $24 billion. As a matter of fact, every time I hear opposition member reference Cornwall Regional, they move the figure from 23 to 26 to 27. So let me just say, up to now, up to this point, we have spent $9.4 billion, $620 million on professional services, $5.8 billion on works, $235 million on medical equipment, $2.2 billion on the operation of temporary facilities, which needed to be put in place to deal with the persons who are in the facility and subsequent treatment of others, and close to $524 million on support services. This involves some 35 contractors, as I understand it, with a procurement process that at times involved 5 to 7 months to reach a decision. The much talked about $23 billion price tag is a projection. Yes, it's by us, it's a projection, but we haven't spent it as yet. And we are not there yet. The narrative, therefore, of criticizing cost overrun based on a $24 billion is not only an exaggeration, it is a dishonest description of the challenge that we face at Cornwall Regional and the approach that we have taken.
Government advancing plans for Kingston Public Hospital redevelopment. The government is moving forward with plans to construct a new Kingston Public Hospital KPH, the largest multidisciplinary facility in the public health system. I am happy to announce that we have now identified lands for lease to purchase and have commenced planned for the new KPH, Minister of Health and Wellness Dr. Christopher Tufton noted. He was making his contribution to the 2025-2026 sectoral debate in the House of Representatives on Tuesday. The hospital, which operates its doors in 1776 and currently has 484 beds, faced challenges due to the aging infrastructure and poor maintenance. We need to avoid a second Cornwall Regional Hospital. As a government, we are therefore now focusing on the Kingston Public Hospital. A land use survey report was prepared on the properties around KPH, inclusive of the 35 parcels identified. The National Land Agency is coordinating the compulsory acquisition of the required land, Tufton noted. Meanwhile, significant renovations are programmed for other health facilities across the country, among them the University Hospital of the West Indies, UHWI. Tufton informed that the process for the UHWI project is now in the final stages of procurement and will see the construction of a 6-story, 120,000 square foot medical facility, which will accommodate 40 additional medical and surgical beds, improvement to outpatient or ambulatory surgery, lecture room, and conference rooms. Also included is the upgrade of the cardiology hybrid interventional surgery room as well as the neonatal intensive care and administrative departments, together with Western Children and Adolescent Hospital, which is 220 beds, and in that final stage of completion, we expect that we should be completed sometime this year. These developments should see the island with more than 450 additional beds being added, the cadre of beds in the country Tufton noted. To subscribe, like, share, and click the notification bell for daily updates.